Hello everyone, my name is Christian Bernard and this is my final presentation on the U.S. healthcare delivery system. So we're going to start by defining the U.S. healthcare system. The United States healthcare system is a massive complex network involving various stakeholders including healthcare providers, facilities, purchasers and payers, educational and research institutions, medical suppliers, public health organizations, and governing agencies and organizations. The U.S. lacks a national health insurance program, making the healthcare system unique. Citizens obtain health care through different means, causing the system to be highly fragmented, which has led to issues in the cost, access, and quality of health care. An effective healthcare system should enable all citizens to obtain needed healthcare services and ensure that services are cost-effective and meet certain established standards of quality, which the U.S. healthcare system has failed to achieve. So this diagram shows that cost, access, and quality are deeply intertwined, with each component playing an essential role in an effective healthcare system. Policymakers must utilize collaborative approaches to develop effective strategies that expand access and improve quality while reducing costs to meet the needs of diverse patient populations, achieving long-term sustainability and ensuring positive patient outcomes. So why is understanding the U.S. healthcare system important? Understanding the U.S. healthcare system is important for several reasons. Understanding the U.S. healthcare system is important in navigating the complex healthcare system and making informed decisions. An understanding of how the healthcare system works is important in helping individuals become aware of and navigate their care options, ensuring appropriate, timely, and effective care, while helping them make well-informed decisions that are right for them. Understanding the system also improves access to resources and healthcare services. Being informed about available resources empowers individuals to utilize services, which can improve health and well-being. Understanding the healthcare system also helps manage healthcare costs, because understanding healthcare finance allows stakeholders to better manage costs and make cost-effective decisions. Improved quality and efficiency is also a benefit to understanding the healthcare system, as understanding the components of the system and how they interact helps to identify efficiencies and opportunities to enhance the quality and effectiveness of care. Understanding the healthcare system is also essential in policy and healthcare reform, as an in-depth understanding of the system is essential for policymakers and various stakeholders to design and implement effective healthcare policies. So now we're going to define some of the providers of healthcare. There are various providers that render care to individuals and communities. These include physicians, non-physician providers like advanced practice nurses and physician assistants, dentists, nurses, pharmacists, and other allied health professionals like therapists, technicians, and assistants. So what do physicians do? Physicians play a central role in the delivery of healthcare services by evaluating patients and health conditions, diagnosing abnormalities, prescribing treatments, and promoting preventative care. Physicians also participate in medical education and research, contributing to new and better ways to control and cure health problems. So what do non-physician providers do? Non-physician providers are clinical professionals who practice in many areas similar to those in which physicians practice, but do not have an MD or a DO degree. There are different types of non-physician providers, including advanced practice nurses and physician assistants. So what do advanced practice nurses do? Advanced practice nurses possess a higher level of education and clinical experience than RNs and play a more advanced role than RNs, taking on responsibilities such as diagnosing and treating patients. They also play a major role in research and evidence-based practice, as well as leadership and management. Nurse practitioners, certified registered nurse anesthetists, certified nursing midwives, and clinical nurse specialists are all advanced practice nurses with varying roles. Nurse practitioners and certified nursing midwives play a significant role in providing primary care to individuals. So what do physician's assistants do? Physician's assistants or PAs work in a dependent relationship with a supervising physician to provide comprehensive medical care to patients. The major services provided by physician's assistants include evaluation, monitoring, diagnostics, therapeutics, counseling, and referral. So what do dentists do? Dentists treat and diagnose dental issues and play a crucial role in helping individuals maintain oral health. They also perform oral surgeries and collaborate with other healthcare professionals to manage various conditions. What do nurses do? Nurses are the largest group of healthcare professionals. Nurses work in a variety of healthcare settings, caring for sick and injured patients, addressing their physical, mental, and emotional needs. Nurses assess, monitor, and evaluate patients while coordinating care and advocating for patients. What do pharmacists do? Pharmacists dispense medications prescribed by a licensed provider. They also educate patients and healthcare professionals on drug products and serving as experts on specific drugs, drug interactions, and generic drug substitution. So who are allied health professionals and what do they do? Allied health professional is a broad term for healthcare professionals that receive specialized training to deliver specific healthcare services, which may include identification, evaluation, and prevention of diseases and disorders, dietary and nutritional services, rehabilitation, and health system management. Their interventions complement the work of other healthcare professionals, so they work together. So how do providers create or address inequity in healthcare access? Providers can create or address inequity in healthcare access in various ways. Physicians may create inequities in healthcare by exhibiting implicit bias, causing them to treat patients differently depending on the patient's race, ethnicity, gender, or other assumed or actual characteristics, which creates disparities in healthcare. Cost and lack of resources can contribute to physicians providing variations in care, creating inequities. Physician maldistribution contributes to inequities. Rural areas in particular lack an adequate supply of both primary care physicians and specialists, even though residents in rural areas tend to be sicker, older, and poorer than those in non-rural areas. So physicians can address inequities in healthcare by providing culturally competent and patient-centered care, advocating for policy changes, working in underserved communities, educating others on health disparities, and assuming leadership roles. So non-physician providers may create inequities in healthcare too. Non-physician providers can also exhibit implicit bias, causing them to treat patients differently, which creates disparities in healthcare. Cost and lack of resources can also contribute to non-physician providers providing variations in care, creating inequities. Non-physician providers are capable of providing a large proportion of the primary care services provided by physicians, which helps address inequities in healthcare. Non-physician providers have helped to address inequities by greatly expanding the number of providers that can diagnose and treat patients, having a positive impact on the physician shortage, which helps address health inequities. Non-physician providers can help address inequities in healthcare by collaborating and consulting with other healthcare professionals, educating patients and other nurses, conducting research projects, participating in the development and implementation of quality management programs, critical pathways, case management, and standards of care, and advocating for policy change. So dentists can also create and address inequity in healthcare. Dentists can also exhibit implicit bias, causing them to treat patients differently and provide variations in care, which creates disparities in healthcare. Cost and lack of resources can also contribute to dentists providing variations in care, causing inequities. Like physicians, dentists can address inequities in healthcare by providing culturally competent and patient-centered care, advocating for policy changes, working in underserved communities, educating others on health disparities, and assuming leadership roles. Nurses can also create inequity in healthcare. Nurses can also exhibit implicit bias, causing them to treat patients differently and provide variations in care, which also creates disparities in healthcare. A lack of resources can also contribute to nurses providing variations in care, creating inequities. Variability in care practices and adherence to protocols can lead to inconsistent treatment, which also creates inequities. Nurses can also address inequities in healthcare. Nurses are in a unique position to address healthcare inequities as they often spend the most time with patients. To address inequities, nurses can provide culturally competent and patient-centered care, advocate for policy changes in patients, engage in community outreach, provide health education, contribute to evidence-based practice and research, collaborate with other healthcare professionals, and assume leadership roles. Pharmacists can also create and address inequity in healthcare. Pharmacists also can be prone to implicit bias, and a lack of resources also applies to pharmacists. Inadequate access to medications due to high costs, insurance limitations, or pharmacy location can create disparities, particularly for low-income or uninsured patients. Pharmacists can assist patients by helping them access needed medications and providing medication education, which helps prevent inequities. So now we're going to move on to healthcare settings. Individuals receive care in a variety of healthcare settings. These settings can be categorized into 3 different groups: inpatient, outpatient, and long-term care settings. Inpatient care settings require an overnight stay. There are different kinds of inpatient hospitals that provide various services to patients. Outpatient care settings do not require an overnight stay. Outpatient care settings include physicians or providers' offices, urgent care centers, outpatient surgery centers, home health agencies, health clinics and centers, and emergency departments. Long-term care settings provide care over an extended period. Long-term care settings include nursing homes, assisted living facilities, rehabilitation centers, and hospice. So each healthcare setting creates or addresses inequities in different ways. Hospitals create inequity in several ways. Hospital location and accessibility contributes to inequities. Health systems in rural communities are often under-resourced, understaffed, and of small scale, and in recent years, many rural hospitals have closed. Unequal distribution of resources, such as advanced medical equipment or specialized staff, can lead to disparities in the quality of care provided to different populations. Policies related to insurance and payment can affect access, causing patients to deny treatment, creating inequities. Hospitals can address inequities in healthcare by providing acute care services, educating health professionals, serving as a site for research, organizing community health promotion and disease prevention activities, and acting as safety net providers. Physicians and provider offices can also create inequity and address inequity. Physicians and provider offices may contribute to inequities in healthcare through limited appointment availability, insurance and payment policies, and accessibilities. They can address these inequities by offering flexible scheduling and extended hours, employing inclusive insurance policies, improving accessibility, and assisting patients through navigation and community engagement. Urgent care centers can also contribute to inequities in healthcare through location and accessibility, cost and insurance issues, and hours of operation. Although urgent cares are more cost-effective than ERs, many individuals cannot afford to pay. Urgent cares can choose strategic locations, accept all forms of insurance, and extend operating hours to help combat inequities. Outpatient surgery centers can help address inequalities in healthcare by being more cost-effective than inpatient surgery. However, location, accessibility, insurance acceptance, and limited service offering may contribute to inequities. Improving inequities would require strategic locations, acceptance of all forms of insurance, and expanding services. Home health agencies also contribute to inequity through geographic limitations, financial barriers, and limited service availability. Improving inequities would require strategic locations, acceptance of all forms of insurance, and expanding services in this area as well. Health centers and clinics address inequity in healthcare by providing preventative and wellness care and helping patients navigate the healthcare system. Emergency rooms can also contribute to inequity in healthcare. They can do this through overcrowding and wait times, financial and resource barriers, and access. However, ERs provide patients who are having a medical emergency with access to care regardless of their ability to pay. Improving inequalities would require strategic locations and increased funding for adequate resources to provide care for patients. Long-term care settings also create some inequities in healthcare. Nursing homes, assisted living facilities, rehabilitation centers, and hospice contribute to inequity in healthcare through geographic location, cost and payment policies, eligibility and admission criteria, and quality and resource variability. These barriers can be addressed through strategic placement, financial assistance, quality standards and accreditation, and inclusive admission policies. So now we're going to talk about the purchasers of healthcare. There are various purchasers of healthcare services and ways in which individuals obtain healthcare coverage in the United States. These can be divided into three main groups, including private insurance, government insurance, and self-pay or individuals. So there are three different types of private and government insurance. Private insurance includes individual private insurance, group insurance, and self-insured or self-funded plans, while government insurance includes Medicare, Medicaid, Children's Health Insurance Program or CHIP, and TRICARE. So how does private insurance work? Private insurance includes many different types of health plan providers, such as commercial insurance companies like United Health Group, WellPoint, Cigna, and Aetna, Blue Cross/Blue Shield, and managed care organizations. Private insurance often requires the insured to pay premiums, deductibles, and co-payments or co-insurance. Plans also typically have an out-of-pocket maximum. So the terms from the previous slide are going to be defined here. Premiums are the monthly amount paid for coverage. Deductibles are the amount paid out of pocket before insurance coverage begins. Co-payments are fixed out-of-pocket amounts paid for specific services, while co-insurance is an out-of-pocket expense based on the percentage of the cost of care. The out-of-pocket maximum is the amount an individual will pay in a year for covered services. Once reached, the plan covers 100% of costs. Individuals receive care from providers who submit claims for the care and services provided to the insurance company. The insurance company processes the claim, then the individual pays any remaining out-of-pocket costs. So now we're going to go over the different types of private insurance. Individuals can buy private insurance plans directly from insurance companies or through online marketplaces and brokers. Group insurance is an insurance policy obtained through an entity such as an employer, a union, or a professional organization under the assumption that a substantial number of people in the group will participate in purchasing insurance through that entity. Employer-sponsored health insurance falls under group insurance, which is quite common in the U.S. Plans differ among employers, but virtually all employer plans cover hospitalizations, physician visits, prescription drugs, and outpatient and inpatient mental health services, among many other health services. Self-insured or self-funded plans are plans in which the employer acts as its own insurer, assuming the risk by budgeting a certain amount to pay the medical claims incurred by their employees. So now we're going to talk about government insurance. So how does government insurance work? Government health insurance programs are funded and administered by various government entities. Like private insurance, individuals receive care from providers who submit claims for the care and services provided to the appropriate payer. The payer processes the claim, then the individual pays any remaining out-of-pocket costs if applicable. So now we're going to go over the different types of government insurance. The first type, Medicare. Medicare is a federally funded program that provides insurance to individuals 65 years and older, disabled individuals who are entitled to Social Security benefits, and people who have end-stage renal disease. So there are 4 parts to the Medicare program. The first part here is Part A, which essentially covers hospital, skilled nursing facility, and some home health services, which are paid for by the payroll taxes earmarked for the Medicare program. Part B is a voluntary program that covers outpatient care, doctor's visits, and preventative services. Part B participants pay an income-based premium. Part C includes Medicare Advantage plans that are offered by private insurers and include coverage from both Part A and Part B, and often Part D. Part D is a voluntary prescription drug program that requires individuals to pay a monthly premium to Medicare. So now we're going to talk about Medicaid. Medicaid is a taxpayer-funded program jointly financed by states and the federal government. The program provides health insurance to low-income individuals and families, including children, pregnant women, elderly individuals, and people with disabilities. Medicaid provides a broad range of services such as hospital and doctor visits, long-term care, and prescription drugs. Many states use managed care organizations and contract with private health plans to deliver services. So the CHIP program is a federally funded and state-funded program that provides health insurance to children in low-income families who do not qualify for Medicaid but cannot afford private coverage. The program covers checkups, immunizations, doctor visits, prescriptions, dental and vision care, and inpatient and outpatient hospital care. Like the Medicaid program, states use managed care organizations and contract with private health plans to deliver services. Now we're going to discuss TRICARE. TRICARE is the health care program for uniformed service members, retirees, and their families. It provides comprehensive medical coverage, including hospital care, outpatient services, prescription drugs, and preventative care. TRICARE offers various plans that can be combined with Medicare for those 65 and older. Beneficiaries can obtain health care through the Department of Defense Medical Services or from civilian providers and can choose to use their TRICARE or Veterans Administration benefits for each separate episode of care. So now we're going to talk about individuals and self-pay. So individuals may not have private or government insurance, which results in the individuals paying out of pocket for all healthcare services. So each type of insurance plan can create or address inequities in healthcare. So we're going to start with the private insurances. Individual private insurance can create inequity in healthcare through high costs, coverage gaps, network limitations, risk pool and underwriting, and geographic variability. The Affordable Care Act attempted to address some of these risks through subsidies and cost-sharing reductions, expanding preventative services, coverage requiring insurance plans to cover essential health benefits, and protecting individuals against discrimination. So, group insurance can create inequity in healthcare through access being tied to employment, high costs, coverage variability, regional or geographic variations, and risk pool and underwriting. As with individual private insurance, the Affordable Care Act attempted to address these inequities in the same manner. So self-funded plans also create inequity in healthcare they do this through the plan design and benefits, cost-sharing requirements and risk pool size, geographic and demographic disparities, and administrative complexity. Self-funded plans must comply with certain provisions of the Affordable Care Act, including coverage for essential health benefits and preventative services. So that does help address inequity. Strategies to improve self-funded plans include improving access, providing cost assistance, utilizing inclusive plan designs, regularly evaluating plan effectiveness, and employee engagement. So Medicare can create inequities in healthcare through coverage gaps, out-of-pocket costs, complexity and navigation, and network limitations. Although inequity among Medicare enrollees exists, Medicare has improved inequity and access by providing seniors and disabled individuals with broad healthcare coverage, financial assistance programs, regulations and protections, access to additional coverage options, and support services. Additionally, the Affordable Care Act included provisions to expand coverage and benefits, provide cost savings and financial assistance, improve care quality and efficiency, and support long-term care. So Medicaid also has some inequities that come along with it. Medicaid does also address inequities in healthcare by providing comprehensive coverage to low-income individuals, supporting vulnerable populations, and implementing quality improvement initiatives. However, like I mentioned, there are some ways in which the program creates inequities. These include variability in state implementation, benefits variation, eligibility limits, provider access and low reimbursement rates, and complex enrollment and renewal. The Affordable Care Act attempted to address inequities by expanding the Medicaid program. So the CHIP program addresses inequities in healthcare by providing health coverage to children in low and moderate income families who do not qualify for Medicaid but cannot afford private insurance. However, the Medicaid program, variability in state implementation, benefits variation, eligibility limits, provider access, and low reimbursement rates, and complex enrollment and renewal cause healthcare inequities. So TRICARE addresses inequity in healthcare by providing a wide range of healthcare services to uniformed service members, retirees, and their families at an affordable price. However, the program can create inequities through geographic and plan variability, enrollment and eligibility changes, varying quality of care, and cost variations. So individuals that are self-pay that do not have health insurance are significantly prone to healthcare inequities. The high cost of healthcare causes self-pay individuals to lack access to quality care and defer treatment, causing inequities in healthcare. So to conclude this presentation, the healthcare delivery system in the United States is multifaceted. And like I mentioned, it is also very fragmented. And it involves a range of providers, settings, and purchasers, each contributing to the overall function and effectiveness of healthcare. Understanding these components and their interactions and how they interact is essential for identifying and addressing inequities in access and quality of care. By recognizing the challenges and barriers faced by different segments of the system, stakeholders can work towards creating a more equitable healthcare landscape that ensures better access and outcomes for all individuals regardless of their circumstances. And that includes my presentation on the United States healthcare delivery system. Thank you for listening. On the next slide, this is a list of references that you can go to if you would like to learn more information. Thank you for your time and thank you for listening.